everybody, and welcome to All About Health and Wellness, brought to you by All American Wellness. I'm Dr. Kevin Usry. Today I have with me my guest, producer extraordinaire, Ben Castro. Welcome, Ben.
Oh, hello, Dr. Usry. It's so nice to be on here. Thank you so much for having me on your show. I'm excited to kind of share my stories, and I have some questions for you that I'm very excited to ask. So,
I'd be delighted to answer them. Anything you got?
all right. Well, so I will say I've had kind of a stigma with chiropractic and all these things going on with in that industry, just because I actually got injured when I was 16 years old. I broke my L4, my L5. And all my life I was told, stay away from the chiropractor, stay away, you just got to do stretches, which I do. But I saw you, it was amazing experience. I just want to know, what's something out there to make people feel comfortable when they've gotten into an injury? Are there certain injuries that you should stay away from a chiropractor, or should you always go and get checked up and see if your spine is in line?
Well, those are very good questions. Number one, Ben had an issue with an auto accident, and he fractured two areas of his spine. And in a case like that, you would absolutely not see a chiropractor. You need to see a neurosurgeon who's going to attend to those fractures. But once the fractures have healed, like any bone that's been broken and has healed, it's stronger in that area than it ever was prior to the fracture. When a fracture heals, it heals with certain scar tissues, and certain aspects of the bone make it almost like a weld. And so that area is much stronger. And after the bone is healed, then you're certainly safe to see a chiropractor. You need to be concerned about spinal hygiene, making sure that all the bones in your spine are moving normally. This is what protects your nervous system. If you have areas of the nervous system that are irritated from mechanical problems where your spine is not moving properly, we call those subluxations. So the vertebrae has to rotate, it has to bend to the side, it has to move forward and backwards. When it doesn't do that, that's a subluxation. Chiropractors reduce those. There's a number of different ways that they have of reducing it. There's manual adjustments. There are instruments that are used to obtain the ultimate goal of getting that vertebrae to move normally. It's quite painless and quite safe. Chiropractic's been around since 1892. It is a long and storied profession that has many, many benefits. We pay a very, very small amount in malpractice simply because if anything goes wrong in a chiropractic office, which rarely occurs, the amount or the intensity or the seriousness of an issue that wasn't expected to occur is very, very minimal and minor.
So those subluxations. Those subluxations, are there different levels, like a small that's a hard word, subluxations. Are there different levels and different, intensities of those? Or, because I'm sure you've dealt with all different types of subluxations.
Well, a luxation is a bone that is malpositioned. So
Okay.
a subluxation, by its definition, means that, no, it's less than a bone out of position. It's a bone that isn't moving in all of the areas that it is expected to move within the joint space.
Gotcha. Okay. All right. Very, very interesting. Now, you've been doing this practice, I think, from your first episode, almost 40 years?
Well, whatever 1986 to this date in time, 2024 is, somewhere around 40 some odd years,
Okay,
yes.
perfect. Now, where did you start? What gave you that interest? I mean, what gave you that inspiration to, become a chiropractor?
It's a funny story. I was dating a nurse who lived with three other nurses. I showed up for date night at the same time as a chiropractor. And just like most guys who meet each other, we're sitting there by ourselves waiting for our respective dates to be ready. And we're asking each other, what do you do? At the time, I was a paramedic firefighter.
Okay.
And I asked him what he did, and he said, I'm a chiropractor. And I said, what's a chiropractor? He instantly became incredulous. He thought I was just messing with him. I said, no, no, I don't know what a chiropractor is. Tell me. And when he did, it was instantaneous. I said, oh, tell me that again. What is it exactly that you do? And when he told me, I said, well, that's what I want to be.
Wow.
And again, he thought I was just giving him a hard time when I really wasn't. What he told me spoke to me in my core, and I said, yes, that's exactly what I want to be. About that time, the nurse that we apparently were both dating at the same time came down the stairs, and it was one of those freeze frame moments where everybody's kind of aware of what's going on.
Wow.
And I said, well, apparently you're dating Richie as well as me. Why don't you give me 10 minutes with Richie and you guys go out on your date? I'll be fine. And what could have been an area of anguish and jealousy and such was just overshadowed completely about this man who spoke to me and changed the course of my life.
Wow.
And Richie Maltzman, if you're out there and you don't realize that you did it because you probably told so many other young men who weren't sure what they wanted to do, thank you very much for changing the course of my life. Because of you, I became a chiropractor and have found my life's work. And there's nothing else that I would choose to do. I have no regrets about it. I love being a chiropractor.
That's unbelievable. That's a good story. I really I enjoyed that.
Well, it's kind of funny.
It is funny. Now, did Richie continue dating that woman, or?
I have no idea
No
what
idea.
happened to Marianne or Richie for that matter. I imagine Richie is still acting as a chiropractor the way he was excited about what he was doing.
Yeah.
I have to imagine he's doing the same thing.
Wow, that's unbelievable. Very, very cool. I love that story. That's a great. Now, when you guys, you mentioned that you were a firefighter beforehand.
Firefighter, paramedic, yes.
Firefighter, paramedic. And how long were you doing that for before chiropractic?
I found out about that right after high school. My next door neighbor was a firefighter. I went over to his house and asked him, I'm looking for a job. I'm looking to do something. He says, oh, well, because you need to become an EMT, go to college and become an EMT. And, fire departments are just desperate to have EMTs.
Wow.
And if you have your EMT, you can be a firefighter. I said, great. What's an EMT? I had no idea what an emergency medical technology expert was. It's an EMT, and there were different levels that you could obtain and move to becoming a paramedic, which I did. Right out of high school, I started taking the summer courses. By 8 months later, I was a paramedic. I applied for a job with the fire department in Broward County. Got the job, and it was an excellent position for a young man. I was 18 years old.
Right out of high school. That's great.
Oh yes, I had to get a dispensation signed by the governor because we were carrying drugs, all sorts of different pharmaceutical drugs used for emergency purposes. And I was 18. I legally in those days wasn't actually an adult.
Yeah.
So the governor signed that after they found and researched my education, that I in fact took the test and passed it, and I was able to work as a firefighter paramedic in a fire department that didn't have a teenager.
Wow, that's an incredible story. I never knew that. Now, so before your high school, it seemed like you didn't really. Did you have an interest in people and helping and that medical field? Did you have an interest, or were you going a whole different route?
Well, yes. From 16 to 18, I worked for a veterinarian as his assistant.
Oh, very cool. Okay.
And he let me know in no uncertain terms that was highly unusual for me to have that position. But he liked my parents and he liked me, and he gave me the responsibility and the tools I needed to become an assistant.
Wow, so that definitely gave you a good jump start to then becoming the EMT, and now, where you are now, that at the All American Wellness Center.
Yeah.
That's amazing. Now, would you was that your goal, was to create your own practice and have your own facility for people to come in, and
Always.
always to have
Always.
a
Yes.
beautiful. Now, I visited All American Wellness. It was absolutely beautiful, and I actually really liked the structure. It felt like a home. Like, I walked in and it felt like a house. I was like, this is beautiful. I felt like very comfortable as soon as I walked through those doors. Now,
Thank
your of course. Now, your All American Wellness, that's located in. Can you give me the address where that located
Yes,
is?
we're at 1541 Prosperity Farms Road. We're just south of North Palm Beach and just north of West Palm Beach and Riviera Beach in Lake Park, Florida.
Perfect. And I saw on your sign, I knew a couple of the tricks you do there, the chiropractic, but then there was one thing that, kind of stood out to me. And I don't know too much, and I think it's applied kinesiology. Is that correct? And I know it's probably a very depth topic to speak on, but I would love to maybe get a little bit of information about what is applied kinesiology.
Applied kinesiology is a specialty within the chiropractic field. You have to learn these techniques and approaches above and beyond what you learn at chiropractic college. And in addition to standard diagnostic and uh, professional adjustive techniques, you learn these techniques of diagnosis to be used in addition to those standard diagnostic approaches as an additional tool to determine where there may be issues that are affecting the biomechanics, the biochemistry, the biophysics of the body. And so essentially, when you're an applied kinesiologist, you do what a family practitioner would do. You don't use pharmaceuticals, you don't use surgery, but you're dealing with many of the functional problems that affect people on a daily basis, and you utilize natural methods. It may be nutrients, it may be laser therapies, it may be adjustive therapies, it may be acupuncture. And these are the tools we use at All American Wellness.
Oh, that's amazing. So it's using everything. There's no limitations. I guess if that's another kind of how I was thinking about it. You're using all the different tools that you can to find what works best with everyone's body.
Well, as a licensed chiropractor, I'm following the guidelines and the parameters of my license, which allows me to use certain physiotherapies and certain tools. And as long as we practice within those guidelines, that is a professional approach that we do as chiropractors and applied kinesiologists.
Awesome. Now, I don't know if you've ever seen, I've seen some pretty intense videos online where there are people that can't even walk and they come and see you, and then they're able to start, walking, moving their hips better and things like that. Do you have any of those kind of stories? Do you have any clients that you could think of off the top of your head where they wouldn't be able to, barely even walk or pick someone up, and then now they're able to hold their child or something like that sticks out
Yes.
to you? Anything?
Oh, yes. And I think anyone who's been in practice for 40 years has seen those miracle cases, as have all chiropractors. What we do is miraculous. When someone has not had that approach and they need that approach, they have a functional issue affecting their nervous system. Going to a chiropractor is really the first thing a person should do. We're trained at recognizing disease and pathology. So if someone comes in and thinks they need to see a chiropractor, but they have disease and pathology, we immediately refer it to our medical brethren who are going to provide the care that the patient needs for dealing with disease and pathology. If it's a functional issue, quite often it doesn't work in the to and fro position, meaning many times a medical doctor will look at a patient who has functional issues and tell the patient, there's nothing I can do for you. You have no pathology or disease. And the patient walks away frustrated instead of being delighted that the doctor couldn't find anything wrong with him. Because when he or she does, that means you have disease and pathology. Unfortunately, they don't usually say go see a chiropractor. Um, Maybe the best that they'll offer is go to see someone who does functional medicine because you don't have a disease or pathology. That's all I can tell you.
Mm.
For years, the AMA discouraged medical doctors from referring to chiropractors. And there's been a number of lawsuits that occurred in the 80s, and I believe it went up to the Supreme Court. And legally, that has ended. However, some people, just like all people who are steeped in prejudiced attitudes, and I think in some cases they can be reinforced by their mentors, so they just don't refer to chiropractors. They're not familiar with our education.
I think I was going to say the familiarity because I think it's just a whole nother avenue in some way that you can help your body. I mean, a chiropractor can do so many more things. Yeah, I agree with you. Now, you did mention that you were certified, you got certified in acupuncture.
Yes.
Now,
just this March.
just this March.
Yeah.
Congratulations. That's amazing.
Thank you very much.
Now acupuncture, I've seen it's a Eastern medicine, right?
Yes.
Now, I've never actually used what's a great benefit of acupuncture? What's something that the public should know about the usage of it?
Well, a lot of us can agree that Albert Einstein was probably one of the most intelligent men of the 20th century. And Einstein's theory that energy or equals mc squared is basically an explanation that everything is energy. And it derives from everything else, biochemistry, biomechanics, derived from energy. And acupuncture addresses the energy that flows through the body, and specifically it's utilized to unblock areas of energy that are not flowing the way they should, and it's incredibly effective. Just like chiropractic has a lot of miracle stories, people who practice acupuncture also have a number of incredible miracle stories, and acupuncture has certainly stood the test of time. It's 5,000 years old.
That's what I was gonna say. It's gotta at least have some. I mean, exactly 5,000 years old. I mean, I've heard my friends have actually used acupuncture to help with vertigo and things that they've had, and it definitely does make sense. You're hitting those pressure points, you're relieving those energies, like you're saying. So
Yes.
it definitely does make sense. I definitely should try some acupuncture someday.
Well, interestingly enough, the medical field endorses acupuncture over chiropractic.
Really? Okay.
Oh, yeah. Some of the more conservative medical facilities, like the Veterans Administration, it took a long time before they begrudgingly accepted chiropractic services. Again, I think that might have become a legal issue where they were forced to. But they wholeheartedly endorse acupuncture and use it quite a bit for their veterans who have benefited from that technique.
Wow, that's amazing. That's very interesting. I had no idea about that. So that's awesome. Well, Dr. Usry, thank you so much for having me on your show. I mean, I cannot wait for all these episodes to come out and help the public to see just how much you can help at All American Wellness, and just how you are here and giving this information to people. You're just you're giving this out so people can know how to take care of their self, how to take care of their body, and it's going to help so many other people around them. And yeah, definitely.
Well, Ben Castro, producer extraordinaire, I really appreciate you being my guest. We are on Spotify and Apple and YouTube, so look for us. We're going to be there weekly. We will be giving you more specific ways of catching our podcast in the very near future. And the reason we're doing this All About Health and Wellness podcast is to alert the public and all the things that chiropractic can do. So thank you for joining us. I wish you well. And thank you for Podcast Junkies producing this program. I wish you well and be in good health. Bye-bye now.
Thank you so much.